Hi, it's Dr. Lara here with The Secret to Giving Birth. Tonight I'm going to be talking a little bit about fatigue and nutrients that can be very helpful for that. So I'm going to be talking about B12, I'm going to talk a little bit about magnesium, I'm going to talk about iron, and I'm going to talk a little bit about vitamin D. So I'm trying to turn this around so you guys can see. So I'm adding one more to the list. So these are all nutrients that are very important that you'll find in your prenatal vitamin and postpartum. It's really important that you continue to get these nutrients in. So sometimes beyond the prenatal, you might want to actually increase some of these particular nutrients, and I'll talk about why. So I'm going to talk about vitamin D first. There's the vitamin D. And vitamin D for me is probably the most important of everything that I'm going to talk about. It's one of my favorite vitamins. And it's one of my most favorite vitamins because it's actually a hormone. And the oldest hormone that we know of that's in our body. And every single cell in your body has a receptor site for vitamin D. So I think a lot of people are aware of some of the functions of vitamin D, one of them being that it helps to get calcium into the bloodstream, so it helps you with absorbing calcium. So it has a major role in preventing osteoporosis later in life, and osteomalacia or rickets in kids. This vitamin we know is all about helping to increase calcium, but it plays a much bigger role in that because now we know, okay, there's these receptor sites that are on all of these cells, so it does a lot more than just that. It's a powerful antioxidant. It helps with preventing cancer. We know that it plays a big role in cognitive decline as well. So as people are aging, we know that if they have very low vitamin D status, they're higher chance of having problems with cognition. So we know that it plays a role on the neurological system. So does it play a role in mood? Yes, it does play a role in mood. So in women that are suffering with issues in mood and postpartum depression, vitamin D can actually be very helpful. So making sure that you have good vitamin D status during pregnancy and postpartum is important. It's important for you. It's also important for your baby as well. So individuals in the past that had really poor vitamin D status throughout a pregnancy, their infant has a higher chance of developing rickets. And there's some research to suggest that they may also later in life have a higher chance of potentially having osteoporosis. So there's some research that's being done there. So what can it do for you for energy? It will help with energy, but more importantly, it's going to definitely help with mood. So standard dosing is about 2,000 units. You might need to be higher than that depending on what your status, what your vitamin D status is. So getting your blood levels checked is important, I think, because that way you're going to know whether you're in a good place or not in a good place, and if you should actually be increasing and having a higher amount. Okay, so iron is the next thing that I'm going to talk about. Iron is something that's found in your prenatal vitamin. There'll be a standard amount in there, usually about 30 milligrams is what is in a standard prenatal. And you want to make sure that your iron status is good throughout a pregnancy, and most importantly, postpartum. So it's very common that as women are going through a pregnancy that their iron status is going to start to decline because that baby is sucking the life force from you. I kind of think of them as little parasites, and they're gaining all of your nutrients in order for them to grow. And so it's really common that, at some point in that pregnancy, your iron levels are going to drop. I know with my first pregnancy, my iron levels plummeted. I still remember the urgent phone call from my family doctor who wanted to get me in because my levels were getting low and my hemoglobin was dropping. So hemoglobin is the major component of your red blood cell, and it's made up of iron. Iron is one of the main components that makes the hemoglobin. So if your iron levels drop to a really low point, your hemoglobin will start to drop and you'll develop something called iron deficiency anemia. And then getting back out of that is usually a pretty big challenge. So you don't want to be there. You want to make sure that your iron levels are always in a good, healthy place. So what happens if your iron levels are low? You're going to feel exhausted and tired all the time. You're not going to be able to get up off that couch. Your complexion is going to be really pale. You might have a really hard time exercising. You might find that you're fatiguing really quickly when you're exercising. This is really common when iron levels are low. You might start to notice that you get frequent infections. Iron actually plays a role with immune function as well. So does vitamin D. And so if your iron levels are low, you might notice that you're getting sick all the time, constantly getting colds or just getting frequent infections. Inability to focus, those are some of the things that can be caused by a low iron status. So making sure that your iron levels are in a good place is going to make you feel, I don't know, I think it would make you feel fantastic actually, because if you get into a better place, your energy is going to go up. You're going to just feel a lot better. So make sure that in the postpartum period that you're at least taking your prenatal that has the iron or doing some extra iron on top of that. And again, getting your blood levels checked, really important to make sure that that's in a good place. Okay, so I'm going to talk about magnesium. So that's some liquid magnesium glycinate. That's 250 milligrams. And magnesium is an important mineral that plays a role with muscle function. So proper contraction and relaxation of the muscle is controlled through magnesium. Also calcium and potassium play a role there as well. So do you remember when you were pregnant and you started getting Charlie horses in the middle of the night and you would jump out of bed and your leg or your calf would be like hard as a rock and in major pain? Or you were doing something and your feet start to cramp up or your hands started to cramp. I don't know, I had that happen to me. So that happened in both of my pregnancies, and it's an issue with magnesium and not having enough of it. And again, the baby is sucking those nutrients and utilizing all those nutrients to grow itself. So it's not uncommon for that to happen. Magnesium, as we know, plays an important role in muscle contraction and relaxation, but it also plays an important role in mood as well. So it can be very helpful with improving mood in the postpartum period, and it plays an important role with sleep. So if you're not sleeping, magnesium can be really, really helpful because it does have a nice calming and sedating effect. So if you've got problems going on with stress levels and anxiety levels and feeling kind of down, magnesium can be very helpful for that. If you have additional issues with sleep, magnesium can also be helpful. So it can, again, help to make you feel a whole lot better. The last thing that I'm going to talk about is B12, and I don't have a nice bottle of B12, but I have what I use, which is, you can see that's methylcobalamin. And that is the bioavailable form of B12 in a liquid version that you inject. So you don't inject it, but I inject it, and I can inject it into my patients. And B12 is really, really important B vitamin that again plays an important role with proper production of the red blood cell. So if your B12 levels are low, again, you're going to feel fatigued and tired all the time. So B vitamins can be really helpful to boost up your energy and just make you feel a whole lot better. B12 also plays a protective role on the nervous system as well, so it's involved with the production of the myelin sheath. So if you're somebody that gets numbness and tingling in the extremities, hands, or in the feet, if you're noticing that kind of stuff, that can also be a big sign that your B12 levels are not in a good place. And so using some B12 can be awesome because it can just really boost up your energy and make you feel a whole lot better. And a lot of women, or certainly patients that I have that I see in the postpartum period, can often have low B12 levels. And so this also plays an important role with mood as well. Women that get B12 shots or start to just supplement with a B complex will suddenly notice that their mood improves, their energy improves, and they start to feel better. So those are a few things for me today. I've talked about some iron. I've talked about magnesium. I've talked about vitamin D, my favorite vitamin. And we talked about B12. So that's all I have for today. If you like the video, please give it a thumbs up. Please go to our Facebook page and like and share. And that will get you on our list so that you can see when we're doing our next Facebook Live. And I hope to see you again soon. Thanks.